Good afternoon, everyone. I'd like to welcome you to today's webinar, Ask the Helpline, with the Ehlers-Danlos Society's very own Shani Weber and Rebecca Gluck. My name is Sarah Jo Ritchie. I'm the volunteer coordinator at the Ehlers-Danlos Society, and I'm your moderator today. Now, this is a very special webinar we are bringing to you today. It's not necessarily part of our usual programming, Living with EDS and HSD, but we hope that by doing a webinar like this, you'll get an inside look that gives you a better idea of what our helpline does on a daily basis. And you just might find that it is a resource that you or your health professionals want to make use of. So this is how today's webinar is going to work. As usual, webinar attendees are going to be muted at all times. If we have time at the end of the webinar, Shani and Rebecca will try to get to as many of your additional or follow-up questions as possible. So what that means for you is that any point during this webinar, you are able to type any questions you might have into the question box at any time. Shani and Rebecca will not be able to see or respond to any of these questions until the end of the presentation if we have time. Please don't send your questions more than once. It will not increase your chances of having your question answered. It will only make it harder to sift through the questions to get to as many as we can. Just please be aware that due to the volume of emails we have received for this webinar, we may not have time to answer any additional questions. If we're not able to, please reach out to our helpline. You could email, you can call, and Shani and Rebecca will make sure you get your questions answered. After spending many years as a special education teacher, Shani Weber had to step back from teaching due to hypermobile EDS, and she became a volunteer here at the Ehlers-Danlos Society in 2012. Since then, Shani has done some wonderful things to benefit the EDS and HSD community and is now on our staff as our Community and Advocacy Director. Not only does Shani moderate Inspire, which is the Society's online support community, but she also assists patients and doctors from around the world that reach out to our helpline. Along with those two roles, Shani is also a patient advocate and speaks with our national and state government representatives and the medical community about EDS and issues that our community faces. In addition to all of that, Shani co-founded and co-leads the Maryland EDS group. I personally have the honor of working alongside and co-leading the Junior Zebras program with Shani. Also with us today is Rebecca. Rebecca received her Master of Science degree in Physician Assistant Studies with honors from Towson University and is board certified by the National Commission on Certification of Physician Assistants. Rebecca joined our staff as our Patient and Education Coordinator after working alongside Dr. Frank Amano at the Ehlers-Danlos Society Center for Research and Clinical Care at the Greater Baltimore Medical Center. Thank you both so much for being with us today.
Of course.
Thanks for having us.
Okay, to get started, Rebecca and I are going to read the questions that we received and provide the answers. We're going to take turns with that so that we can rest our voices so that you don't get tired of just one of us speaking. So I'm going to begin. We received a number of questions regarding pain and pain management. I can tell you this is one of the most common questions we get on the helpline. So many of us living with a type of EDS or HSD experience pain of different types, and how to lessen that pain, to better manage that pain is a priority for so many of us. Of course, it is important to work with your doctors to determine what is causing your pain, because sometimes that cause can be addressed, and that's a great way to lessen the pain that you have. But in addition to that, it's also important to effectively manage the pain that you have. I'm going to start with the first question. I am 80 years old with a body filled with metal, having had more than 50 procedures. I recently suffered a herniated disc in the C7 to T1 area of the spine. This has caused pain from my neck all the way down my right arm to my fingers. I recently had an epidural which relieved the pain for a week. I can't take opioids because they cause severe insomnia, and I can't take anti-inflammatories because of ulcers. Tylenol is useless. Are there any other pain relievers I can take? We also received the question of what do what to do when NSAIDs, anti-inflammatory medications, and Tylenol just aren't working. Well, when thinking about pain medications, there are many different types. As was already mentioned in these questions, there are non-steroid anti-inflammatory medications like ibuprofen. You'll also see these as prescribed medications like Celebrex. And these are very commonly taken medications as a first step to trying to manage pain with medications. But there are different types of pain medications that address different types of pain. For instance, there are muscle relaxers that are helpful for individuals who have persistent muscle spasms. There are medications that are used off-label. For instance, anticonvulsants like Lyrica and Neurontin, brand name, the generic is gabapentin, are often used off-label for nerve pain, for types of neuropathy. There's medications specifically designed to treat migraines, and there's medications specifically for gastrointestinal pain or for spasms in the urinary tract, for examples. And so talking with your doctor, not only about pain medications, talk about what types of pain you have and that you are experiencing. This can lead both to determining what is causing your pain, as well as what types of medications may be more effective in managing that pain. But it's also important to use a lot of non-medicinal tools, non-medication tools to effectively manage pain. So it's not all about taking pain medications. That's only one part of effectively managing the pain that you have. Before I go into some of what those options are, I want to mention we received another question about what to do about TMJ pain, your temporal mandible joint. What happens when you have this kind of pain along your jaw, up to your ear, and it can come down into your neck? And what you can do, that's a specific type of pain, you can work with your dentist or a TMJ disorder specialist who may be an oral surgeon instead of a dentist. Many people find for TMJ disorders that a custom fitted mouth guard is helpful because sometimes that pain is being caused by clenching your teeth at night or by having a bite of how your teeth are aligned when you're chewing. And so it's important to figure out what types of pain you're having to know how to effectively treat that pain. But in general, types of EDS and HSD can cause both chronic pain and acute pain, right? So many of us have experience with that. And so to address that, we often have to have a variety of medications and non-medication tools to effectively manage that pain. And that requires us to become kind of tool collectors, pain management tool collectors. Collecting as many tools as possible can really help you have appropriate pain management tools when you need them. When you suddenly have acute pain, you have an injury or a flare-up, you can have appropriate tools available then to treat that pain. Some of the tools that I personally use, I use a TENS unit. I find this to be very helpful. I use a heating pad. I use ice. I use topical products like BioFreeze or Tiger Balm, depending how I'm feeling. I love to take warm baths with Epsom salts. That really helps, especially with sore muscles or muscle spasms. I do use braces, particularly if I'm feeling really unstable that day, or if I know I'm going to be more active than usual, which for me does exacerbate what pain I get. I also have a situational wheelchair that I love, absolutely love. Remember that wheelchairs are just a tool. It's not giving up. It's not a failure if you are in a wheelchair. It's just one more tool. It's a tool that actually gives you more freedom, that allows you to do more things and go more places that you wouldn't be able to do if you're not able to walk that far or for that long. And so using tools, pain management tools, whether it be a TENS unit or whether it be a situational wheelchair, can help you better manage your pain. I find that consistently doing my physical therapy exercises can sometimes lessen my pain, depending what kind of pain I'm having someday. Getting gentle massages, I can't do deep tissue massages, but some types of massages I can tolerate, and having my family members help with that. Some people really enjoy acupuncture or dry needling as a way to help with their pain. These are options. Deep breathing exercises, distraction are also tools to help manage pain. I do also take pain medications and work with my pain management specialist to find the pain medications that are appropriate for the types of pain that I'm experiencing. And so having both medications that help treat the types of pain you have, but also collecting many different types of pain management tools can help you lessen the pain, help you function better. And I do want to mention, it's not a good idea to just try to ignore moderate to severe types of pain. Untreated or undertreated pain has really bad effects on our health. Everything from affecting our brains, which can affect our memory and our cognitive abilities, to weakening our immune system, something with COVID-19 going around the world we do not want to have our immune systems weakened, and can lead to depression and all kinds of issues. So it's very important to effectively manage the pain that you have, using tools that are both non-medicinal, as well as, if you need them, pain medications of types that are appropriate for the pain that you have. And so that's kind of a general roundup of what do you do when you have pain? What are your options? I'm going to turn it over to Rebecca now. Oh, actually, let me explain. I'm sorry, Rebecca. One more thing I wanted to talk about before turning it over. I learned long ago from Dr. Frank Amano a wonderful strategy. When you have pain, it's good to layer the different options, pain management options that you have. So let's say you take pain medications and they help with lowering your pain maybe 20% from where it was. But then you use a heating pad where it hurts, and that lessens the pain another 5%. And what if you use maybe some BioFreeze or Tiger Balm, another topical option, right where it's really hurting, and that lowers the pain right there another 10%. What if you a little bit later take a warm soak with Epsom salts, and that lowers your pain another 10%. And you do some deep breathing exercises, and you do some of your PT exercises, and that lowers your pain another 15%. While none of the pain management tools can effectively treat all of your pain, layering what pain management tools you use using them together can significantly lower the pain that you're experiencing. So don't think of it just as, if I just take this medication, my pain's going to be effectively managed. It's about using all the tools that you have. Don't forget regular health things that aren't EDS specific. For instance, if you have low vitamin D, that can cause muscle pain, and it can cause higher levels of pain. So making sure that your blood serum level is at least 40 can also help affect the pain that you have. Not letting other problems that are not EDS specific cause your pain. Addressing those can also lessen your pain. If you experience joint instability, we're going to talk a little later about physical therapy and appropriate exercise, but building that muscle tone to better support your joints can lessen your pain. That's another way to manage your pain effectively. Don't forget that on our website and YouTube channel, we have many webinars and presentations from past conferences specifically about managing pain. So please take the time that you have while we're all in our homes to watch some of those webinars and videos, and to read some of the articles that we have on our website about managing pain effectively. I'm sorry about that, Rebecca. Can I turn it over to you now? Because I know fatigue is another big question that we get asked about.
Sure, thank you, Shani. So the next couple questions that we got in were about fatigue. How much fatigue is normal for a child with classic EDS? My daughter is very hypermobile and struggles to get through the day at school. We've made accommodations at school, but she still feels so tired in the afternoon. Any suggestions would be appreciated. And another, how to manage fatigue. This is, like Shani said, another common question that we get asked a lot. To address the first question first, each child is different. There is no normal level of fatigue. Each child is different. Each type of EDS is different. How it affects each person is different. So there is no kind of normal limit or threshold that we can describe, but determining what is causing the underlying fatigue and addressing it can help us figure out how to improve and make her day a little easier. Sleep disorders and fatigue are very common problems for those who have a type of EDS or HSD. There are quite a few different causes, and what to do about it, how to best address it, does depend on the underlying cause. So sleep apnea, other sleep disorders are things that can be picked up on a sleep study, which is often a helpful diagnostic tool. And if one of those is found, treating that specifically can help manage fatigue. For those who have POTS, postural orthostatic tachycardia syndrome, or other forms of dysautonomia, so problems with the autonomic nervous system, sleep can be disrupted. The autonomic nervous system controls all the things that we don't usually have to think about doing. Sleep is a big part of that. So one of the ideas is that extra adrenaline can be released at night, which causes people not to sleep well at night and leads to fatigue during the day. And effectively managing the dysautonomia can help with help improve sleep and fatigue. Another biggie is if pain is not well managed, it can interfere with sleep. It is very hard to get good quality sleep if you're in pain. So managing pain with some of the suggestions that Shani already elaborated on just before can help with sleep and fatigue as well. There are medications that help with alertness. Generally, those are considered after underlying causes are tried to be identified and managed first. So hopefully that is helpful.
Thank you, Rebecca. Very helpful indeed. As you're starting to get a feel for We are all different. And so it is important to determine what type of pain you're having or what's causing your fatigue. While many of us experience pain and fatigue, there's not one answer for everybody. So it is important to work with your doctors to determine what's causing this and what can you do about it. Moving on to other management and physical therapy, exercise type questions. We got a question saying, I met with a geneticist who diagnosed me with hypermobility spectrum disorder. And she said the only treatment for HSD is 20 to 30 minutes of exercise every day. I asked her about pain management, and she said to work through the pain and take NSAIDs like ibuprofen if needed. She advised against bracing. Is it true that I should be exercising through the pain? Is there any recent research on developing an exercise program while managing pain? That's a great question. It's very helpful to have an EDS and HSD knowledgeable physical therapist to evaluate you and to help develop an exercise plan tailored specifically to your needs and abilities, as well as taking into account the challenges that you have with your body. A PT can also help you determine whether bracing would be beneficial and when to wear bracing. Overusing braces is a problem. Our muscles can atrophy, right? But it can be helpful to use a brace if, for instance, you just experienced a joint subluxation or dislocation, to allow that joint to heal. Or if your family is going to take a walk to walk the dog and you need extra support, using kinesio tape or bracing can help add extra stability until you gain enough stability through consistent exercise where your muscles can do that work for you. Whether or not to exercise through pain depends upon the type of pain you're experiencing, though. It's not uncommon for all kinds of people, whether they have these conditions or not, to experience maybe muscle soreness or a mild pain when doing one or another exercise, a PT exercise or other exercise. That's not uncommon, and that's okay to work through. But if you are experiencing a sharp pain, if you're experiencing a pain that feels like something is tearing, if you're experiencing a pain that's new to you, then that's a pain that you don't want to work through. That's a pain where you need to stop the exercise that you are doing. It may be that you can modify that exercise in a way that does not cause that pain, so that you can still target the muscles that you're trying to target, but not experience the pain, not create damage in your body. It may mean that you need to stop that kind of exercise altogether and find a different type of exercise that also allows you to target those muscles, that is more joint friendly, that doesn't cause the type of pain that you're experiencing. Working with your physical therapist can really help in modifying exercises and determining how to do them in a less painful way. It is important for us to every day move our body somehow. It doesn't necessarily even need to be in structured exercises, but we don't want to damage our body when we're doing this. And so finding exercises that help you increase your muscle tone, which can serve as a secondary support structure for your joints, and better stabilize your joints, reduce the number of subluxations and dislocations, can lessen your pain, can make your joints more stable. But we do need to each find how to exercise, to not do damage to our bodies, to do it in a way that is as pain-free as you and I can ever be. So we also got the question, I'd love if you can point me towards some resources for stiff, probably arthritic hands. But we also get questions about hands hurting for other reasons, whether joints are dislocating, whether nerves are impinged through overuse. Hands can be very painful for a number of reasons. Finding a certified hand specialist, hand therapist, is what you want to do about your hands. Often this is a type of occupational therapist, but make sure they're a certified hand specialist to help determine what is causing that pain in your hands. If you have hypermobile fingers and thumbs, some people find wearing braces or silver ring splints or taping them helpful. If your hands are hurting because of overuse, or they're hurting because, well, let me start with overuse. Finding ways to take breaks between the task that is exacerbating the pain in your hands can help. Finding ways to do the task in other ways. For instance, if you're overusing your hands typing, using voice to text software can limit how much typing you have to do. So finding other ways you can do a task where you're not using your hands as much can be helpful. For osteoarthritis specifically, often anti-inflammatories are prescribed. Arthritis is a type of inflammation, and so some people find also wearing compression gloves is helpful. Some people find heat or ice helpful. So, you know, some people use both. And so you can really do that. We also have lots of resources on our website from physical therapists and from hand specialists about what to do about exercising, that you can learn what is EDS and HSD specific exercising and what you can do. We also got the question of during winter months, particularly bad days, what tools should we use? Again, this is why you want to become a great tool collector, whether it's pain management tools, whether it's exercise tools, whether it's mental health tools. Become a tool collector so that when you have those bad days, you have options available to address whatever is going on with you. Your tools may be medicinal, they may be non-medicinal, they may be a foam roller that you can use. Maybe your exercise ball is helpful. Maybe you have bad mental health days, or days where it's hard to cope, especially with everything that's going on right now. Maybe you're feeling more anxious than you usually do. We have on our website a whole long article about managing mental health and coping, and all kinds of tools that you can use, whether it's using grounding techniques where you can stop and use your 5 senses. What do you see? What do you hear? What do you smell? What do you taste? What can you touch? What does it feel like? Or finding 5 things that are in the room or the space that you're in that are all green. The first 5 things that are a particular color. That's called grounding. Meditation, some people appreciate that. There's many tools that you can use. And becoming a tool collector helps us take control of what we're feeling, and really help ourselves feel better. We got the question of, are TENS units okay for people with EDS and HSD? Yes, for most people, check with your doctor. TENS units are safe for those that have a type of EDS or HSD. But it's very important to learn where it is safe to place the TENS unit pads on your body and where it is not safe to place those pads. You don't want to put the pads directly over your heart. You don't want to put the pads directly on your spine. These are two examples. The manual that comes with the TENS unit has the information of where it's safe to place TENS unit pads and where it's not safe. And you can also learn for different where it hurts, whether it's your shoulder or whether it's your back, whether it's your quadriceps, of how to place the pads, where to place the pads for those types of pain. But you can work with your physical therapist and doctor also for help of where is it safe to place those pads. I do want to caution for those of us that have fragile skin, removing those sticky pads can cause a bit of a problem. So do it carefully if you have fragile skin. And then we got the question finally of, do many people with EDS have good results with physical therapy? Yes, many people with a type of EDS or HSD have great success with physical therapy. However, it needs to be physical therapy and exercising that's appropriate for us. Often traditional or rehabilitative physical therapy or exercises can damage us. And so it's important for you to learn what is appropriate physical therapy exercises and general exercises, and figure out what's appropriate for you, how your type of EDS presents in you, how your type of HSD presents in you. The general guidelines are avoid contact sports, avoid high impact activities, and avoid hyperextending your joints. Appropriate physical therapy exercises and general exercises are those that are gentle on our joints, but allow us to increase our muscle tone. About muscle tone, remember, muscle strength is what we get when we contract our muscles. It's what we do when we push something or pull something or lift something. Muscle tone is different. Muscle tone are all those small muscles that are tasked with supporting our joints, and muscle tone are our muscles' ability to support those joints even when we are at rest, even when we're sleeping. If you have good muscle tone, your muscles are able to stabilize those joints. So it's muscle tone that we're trying to achieve and increase. Examples of gentle exercise would be walking or hiking, swimming, or doing exercises in the water, like aqua walking, aqua jogging, and other exercises. Bicycling can be gentle on the joints. Horseback riding can be gentle on the joints if you enjoy that, but no jumping or rodeo barrel racing or steeplechase events. And that's kind of similar thing when you're on your horse, because those aren't joint friendly. Pilates and clinical Pilates are great gentle types of exercise that can help increase muscle tone as well. There are many ways to move your body. There's types of dance that you can just put on the radio or your iPod. Sorry, I'm old school. Or wherever you get your music, and just dance. That can move your body and increase your muscle tone. It doesn't have to be a structured exercise. Just find ways each day that you can move. You can move if you have to lay on the couch or you're bedbound. You can also increase your muscle tone. Just moving your body throughout the day can help you increase your muscle tone. We have so many resources on our website. We have videos, we have articles about EDS and HSD appropriate exercise and physical therapy. Learning how to identify what is appropriate and what is not appropriate can help you when you're at the physical therapist know if an exercise is appropriate or not for you. And so I encourage you to learn what is appropriate. Rebecca.
Thanks, Shani. So the next question that we got in is stretchy skin part of HSD too, or would that point you more towards EDS? Great question. So the diagnostic criteria for the different types of EDS are made up of groups of features that when they're seen together in one person, they can be indicative of a heritable connective tissue disorder. Most of these features individually can be found pretty commonly in the general population. So one feature by itself, such as stretchy skin, like this particular person was asking about, doesn't necessarily mean that someone has EDS or another connective tissue disorder. A person has to have multiple features as specified in the criteria to be given an EDS diagnosis. So yes, a person with HSD can have stretchy skin, or for example, a high narrow palate with dental crowding, or very long arms, or any of the one particular features that can be seen as part of the EDS diagnostic criteria, but unless someone meets the full criteria, they would not be given an EDS diagnosis. It is complicated, it can be a little bit confusing, so it's best to be evaluated by a geneticist or another physician who's knowledgeable about heritable connective tissue disorders if there is a diagnosis in question.
If I could mention, Rebecca,
yes.
It depends where you live. In the US, it's usually a geneticist, but one that is knowledgeable about connective tissue disorders, who is best to see for assessment of types of Ehlers-Danlos syndromes. However, in other parts of the world, for instance, the UK, it's often a rheumatologist. But that same caveat is there of one that specializes in connective tissue disorders. So it depends where in the world you are of who is best to see.
Yes, thank you. Good point. The next question was, do your teeth fall out with hypermobile EDS? It is not common for teeth to fall out with hypermobile EDS. Some people who have EDS do lose one or more adult teeth in their lives. We do see that practicing good dental hygiene, regular brushing and flossing, seeing the dentist as recommended can help preserve your teeth. So not a common feature, not usually something that we see with hypermobile EDS, but we do hear people report problems with teeth. Next question. I just recently had bone spurs removed from my lower jaw because of my EDS. Is this very common? And is there anything to keep it from happening again? So bone spurs in the jaw are not something specific to EDS necessarily. One reason for bony growths in the jaw is because of a poor bite or malocclusion where the top jaw and the bottom jaw don't line up correctly. This leads to uneven pressure distribution in the jaw, and your body kind of tries to line things up, and the strain can cause a bony growth to form. Calcium deposits can also form when there is stress or damage to the bones in the face. A bone spur can also be formed usually at the point of a joint where two bones meet. Usually, that's pretty commonly seen in conditions like osteoarthritis. And depending on what the underlying cause of the bone growth that this person experienced would have to be identified and addressed to reduce the risk of it occurring again. So for example, if something is malaligned, braces or other orthodontia might help line things back up. So it kind of depends on the underlying cause of what might be causing this. Next question, is there evidence that those with hypermobile EDS or HSD have collagen issues with the vascular system? Doctors are trying to figure out whether my vein issues are related to chronic hypovolemia from POTS or whether the difficulties lie with EDS. The problems are difficult stick due to tiny veins, veins that collapse or infiltrate as soon as you push through the wall, tons of valves so nurses can get blood returned but can't thread the catheter, skin blanching and pain when using IV, even if just for fluid, failures of PICCs, fragile veins, chronic phlebitis. So it sounds like this individual is having a lot of trouble with their veins. And to answer this question, it is a question that we do get pretty frequently. There is not any evidence so far in research of any particular structural abnormality in the veins of people with hypermobile EDS or HSD. Many people do describe varicose veins, thread veins, so very hard to get blood draw, easy bruising, similar things. We don't have any research, though, unfortunately, to explain why that happens or how to prevent it. If someone does know that they have trouble with having their blood drawn, don't be afraid to, when you're going to the doctor's office, to let them know right away. I'm a hard stick. Please, do you have the most experienced person on your team so you don't have everyone trying to poke you multiple times? That's definitely a fair request to make right from the outset. So back to you, Shani.
If I could just mention one other thing on that question that was asked. It started out with, let's see, is there evidence that those with hypermobile EDS or HSD have collagen issues with the vascular system? I just want to point out that it is not yet known for sure that hypermobile EDS is a collagen issue. We know it's a connective tissue disorder. However, we don't know for sure it's collagen and what type of collagen it is. And it's also not known yet for hypermobile mobility spectrum disorders, whether it's a collagen disorder. So lots of research going on, and hopefully we'll have those answers, but we're just not there yet. So moving on, another common question that we get, as you can imagine, is how to find doctors where you live. It can be really difficult when so many of the medical community are not knowledgeable about types of EDS and HSD and how to effectively treat them. So here's the first question. Are there any pain management doctor specialists in North Carolina that y'all are aware of? She's looking specifically for a pain management specialist. Another question, although I've had muscle and joint problems since adopted at birth, it wasn't until I was 59 that I was diagnosed with hypermobility spectrum disorder by a rheumatologist in Orange, California. I'm in dire need of finding a dentist, a specialist, other doctors in California or in neighboring states. Another question, which hospital do you recommend going to for more specialized care? We are in Canada, and the EDS clinic at Toronto Sick Kids is no longer taking patients outside of Ontario. We're willing to travel and pay for the best care, knowledgeable physicians. We often get questions like this because so many of us living with these conditions want to get the best care and are having a hard time finding doctors that are knowledgeable. It is important to find doctors and therapists, whether that's physical, occupational, or mental health therapists for your medical team who listen to you, who are willing to learn about these conditions with you. But since there's not a lot of EDS and HS knowledge in the medical community, it's really important that we learn all we can about our own conditions and how to treat them. Most of us have found we have to do this. So learning from information that we have on our website, watching webinars, watching conference presentations, reading the articles under EDS and HSD info can really help you learn what these conditions are and help you learn what treatment options are available. Something that I also do is I have an alert set up on Google Scholar. for Ehlers-Danlos syndromes and for hypermobility. You can set an alert for whatever you want, whether you want it for POTS, whether you want it for mast cell disorders. And in my inbox, in my email, they will send me, if any medical research article gets published that has the keyword of what I've put in my alert, it gets sent to me in my daily report from them. And so I'm able to keep up with what is the new knowledge, what research is being done. And I also can see who is publishing that research, who is researching EDS and HSD. That lets me know who has the best knowledge about these conditions. Looking on our website of who is on our medical board, that's another way to see who are these knowledgeable physicians. Looking to see who is in the Ehlers-Danlos Society's international consortium on EDS and HSD and other associated conditions, is another way to find who really has expertise in these conditions, including the comorbid conditions that we commonly see. So those are ways to find doctors. But you can also look on our website at our medical professionals directory. There's doctors listed there who are excited to see patients with our conditions. But you want to know what the best way to find doctors are that I have found and that many others have found? It's connecting with your local EDS and HSD support group. On our website, you can click on affiliate support groups and charities, that link. Scroll down and click on which continent in the world you live in. Scroll down until you get to your local level and find what is the closest EDS and HSD support group to you. Connecting with others who have these conditions and live near you is a good way to find out which doctors are willing to listen and learn, which doctors do have knowledge about these conditions, and which doctors are probably best to avoid. And so I encourage you to connect with your local EDS and HSD support group to find who is best to see. In addressing the question of what is the best hospital or medical center to go to, there really isn't, at this point, a medical facility that has every medical specialty that you may need, that are all EDS and HSD knowledgeable, all experts in these conditions, and can help you with treatment options for every symptom and comorbid condition you have. It really isn't. And so it's important to build your own medical team with the doctors that are appropriate for the symptoms you have, and start working with them, helping them to learn about these conditions if they're not already knowledgeable. And that is also how you can best see doctors when you need to see them. Because of course, a lot of the top experts have multi-year waiting lists because everybody wants to see them. And what you need is doctors you can see on an ongoing basis to help you manage the symptoms you have. So I'm going to turn it over to Rebecca because she's a great one to answer questions about genetics.
Well, before that, one more thing to add to what you just said. We also have a program called Project Echo, which is a healthcare provider training program. It's free for providers to join. It's virtual. It's on a platform just like the one that we're on now, and doctors can earn continuing medical education credits for it. So if you have a provider who's interested in helping you, who just says, I just don't know enough about EDS or something along those lines, this is a great opportunity for them to learn, to be able to help you and other patients who have EDS as well. So the information can be found on our Ehlers-Danlos Society website. There's a PDF brochure that you can print out and bring to your doctors. So that's another great way to help spread awareness and increase the care that's available for people with EDS. So to go on to our next question. A genetic test confirmed that I am a carrier for kyphoscoliotic EDS. I have many mild symptoms of EDS. My question is, why do some carriers not show any symptoms, but others, like me, do have EDS symptoms? So for this question, we consulted with Dr. Malfate on our team, who is our Chief Scientific Officer, who is very familiar with the different rare types of EDS. And she said that there is currently no evidence that FKBP14, which is the genetic mutation that this person said that they had, there is no evidence that carriers of this particular condition are affected. It wasn't clear from the email question that was sent in what exactly the symptoms were, but based on our current knowledge, there is no evidence to associate what she describes, failed hand surgery, with this carriership. So that is a little unclear there. Next question: can you have classical type with? Oh, sure.
I'm sorry. In that question, whether you have whether your symptoms are caused by a type of EDS or not, it's always important to explore those symptoms with your doctors and work out what your treatment options are. So whether your genetic variant is the cause of your symptoms, you know, we may not know right now or don't have any evidence for, but your symptoms are real, and you need to work with your doctors to effectively manage them.
Yeah, that's a very good point, Shani. Thank you. For probably most of us, we might not know what the cause is, the genetic cause, but the symptoms are still there and they still need to be managed to the best that we can. Hopefully, as time goes on, research is rapidly expanding. We're learning more and more every day. Things that we know now, we didn't know even a couple of years ago. So hopefully more and more answers will be found. But in the meantime, focus is on symptom management. Next question. Can you have classical type without the gene showing up on blood work? My skin is more stretchy and fragile than that of hypermobile EDS. So this is a great question. More than 90% of the people who have classical EDS do have a mutation in one of the genes that encode type 5 collagen, so COL5A1 or COL5A2. It is possible, although pretty unlikely, for someone to meet the clinical criteria for classical EDS and be diagnosed with classical EDS by a geneticist or a rheumatologist, even with negative genetic testing. But there is quite a range of severity of skin symptoms in people with hypermobile EDS, with some people who have hypermobile EDS having really quite normal skin, and some who have very soft, very stretchy, very fragile skin, stretch marks, scarring. So there really is quite a range. It's hard to give. So to answer the question, it is possible. It's probably unlikely if someone meets the criteria for hypermobile Ehlers-Danlos syndrome, then part of that criteria would be excluding that they don't have classical EDS. So that would be up to someone who would be able to examine you in person and evaluate with the full history and physical exam.
Wonderful. We got the question, how do you manage swallowing problems that are related to problems in the cervical spine? I'm choking on liquids and was advised to use thickening powder so I don't continue to aspirate. But the problem is that I get the liquid in my mouth and then can't get it down my throat. I hope you have some answers. I have hypermobile EDS and I'm fused from the skull to L3. When a person has swallowing difficulties, it's best to work with a specialist in swallowing disorders. This may be your ENT, your ear, nose, throat doctor, but also working with a speech language therapist who specializes in swallowing is important, because they can, the two of them can assess where is the problem with the swallowing, at what point are you having troubles in that swallowing process, and what to do about it. Again, you can find who's best to see by connecting with your local support group or by looking on our medical professionals directory for an ear, nose, throat specialist or speech language therapist who specializes in swallowing challenges. They're really going to need to look at your specific case because there's so many different issues and that can affect swallowing, and swallowing is actually a process. So working with your doctor.
Okay, next question. Are autoimmune diseases more common with EDS? That is a great question, and also one that we do get asked a lot. It's a common question. Unfortunately, we just don't really know. Across all areas of EDS and HSD, there are concerns and theories that it might turn out to have an autoimmune or immunological basis. There's definitely research underway looking at this. GI issues, neuropathic pain, neuropathy, mast cell diseases are just a few examples of processes that might fall under an immunological umbrella. So this is something that is currently being researched, and at this point in time, we don't have a definite answer for that one.
Mm-hmm. Question, how can loved ones get more connected with the EDS community? I love this question. Let me start first is if the loved one wants to be connected. Not every loved one wants to be connected with the community, and that's okay. Building relationships with our loved ones doesn't mean that they have to really become part of our community. We'd like them to, but they can do a great job of caring for you, loving you, even without taking that step. But for those loved ones that do want to become connected with our community, they can join one of our virtual support groups. We have quarterly support groups for parents, and we have quarterly support groups for spouses and partners. And so that's a great way for parents or spouses and partners to talk with other parents or spouses and partners to talk about how it's going, or to talk about ways they've found and the challenges they're having and problem solve solutions. And so that can be found under our virtual support groups of when those groups meet. There are also many loved ones who attend local support group meetings. If you have a local EDS or HSD support group near you, there's many loved ones who attend with their family member who has a type of EDS or HSD. And the same for our conferences and other events. We have many who accompany their loved one to our conference or to a screening of issues with my tissues or other events that we may have. Of course, that's back to when we can have events again where we all can come together, but we'll get there. We'll get there. They can also learn about how to care for somebody with EDS or HSD on our website. We have an article on there under EDS or community resources, I guess, about caring for someone that has EDS or HSD. And one of the important parts of that is taking care of themselves. We need them to have time to themselves and do a good job taking care of themselves so that they can be there for us when we need them. Over to you, Rebecca.
Thank you, Shani. The next question is, the spine specialist I've been seeing has sent me for numerous tests and for shots in my SI joint. They want to do the iFuse surgery. Have there been good results for EDS patients for this? So we do get this question quite a bit, or similar questions. Is this particular procedure, is this particular surgery good for people with EDS? Unfortunately, it's a hard question to answer because anyone who has any type of EDS or HSD is going to respond to surgery differently. Even with the same procedure, there are going to be some people who have great results, life-changing results. There are going to be some people who have no improvement at all. There are going to be some people who unfortunately will have a worsening of symptoms or worse pain or some other complication or disappointing outcome. And it, to some extent, we can predict it depending on the type of EDS or the severity of the presentation of, the history of prior surgeries, how they've went, how it has gone, the skill of the surgeon. But until it's done, there's no real way to know for sure.
Just a quick note, when she said that, Rebecca and I cannot predict how your surgery will go, but using your past medical history, even your past history with injuries of how did you heal, do you have abnormal scarring, that kind of thing, and talking with those with your doctor can help provide clues to how you may do with a surgery. But
sure, yeah. Thank you.
Asking us to predict how your surgery is going to come out.
Right, definitely. We certainly can't predict, and there's no way to guarantee. Maybe that's what I meant to say. But even with all of the clues that we can hope, to make the best educated decision of whether or not to proceed with a surgery, there are no guarantees as to how it will turn out. So it's always best, like Shani said, to discuss all of these factors with your surgeon, any past history of injuries, healing, anesthesia, all of these different factors, and to try to address all of the concerns, weigh the pros and cons appropriately. And particularly with a fusion surgery, whenever part of the body is fused, it puts additional pressure on the joints or the vertebrae, if it's in the spine, above and below the area of the fusion. So very often it can lead to increased instability or increased pain or problems in the area surrounding the fusion. So that is something important to keep in mind. We do try, because of these risks, to keep surgery as a last resort and to try to do EDS appropriate physical therapy, exercises, other more conservative treatment, if possible, to try to avoid surgery. Whenever you fuse one thing, it sometimes turns into kind of a snowball effect of needing further surgeries, further treatments, and we want to try to avoid that if possible. So kind of the takeaway is that, like everything else, it is individual to each person. We try to make the best decision making with the information that we have, but in general, if surgery can be avoided, that would be preferred. Mm-hmm. Back to you, Shani.
Thank you. And just to reiterate, when there is instability, even if it's instability in the spine of the vertebrae, consistently doing EDS and HSD appropriate physical therapy exercises to increase that muscle tone can help increase the tone, support those vertebrae, and at least delay surgery, if not even cancel the need for that surgery. Your core muscles, which includes your abdominals, your lower back, your glutes, your flanks, and these areas, they're what are supporting your spine and your rib cage. And so if you have instability in your spine and your vertebrae, doing a lot of core strengthening is helpful. And if you haven't seen it, Jeannie DeBon, who's a physical therapist in the UK, and has a program specifically for those of us with EDS and HSD, and she has hypermobile EDS herself, has provided free access to her core strengthening program. For just 3 months, it's going to be free. You can find the details of how to access that on our website. And so strengthening our core is a good way to delay or avoid these types of surgeries. So the next question is there a point at which it makes sense to just stop seeking treatment? We can get so frustrated of doctors not knowing what our condition is, of treatments not really helping or making us worse. Is there a time where you just stop seeking treatment? What I tell folks is that if you don't have any symptoms that are impacting your life, then yes, it's okay to not be seeking treatment, or it's okay to, if you have management tools at your home or that you can do to effectively manage the symptoms you have, then yes, there's not a need to seek further treatment. But if you have symptoms that are not well managed, if you have pain that's not well managed, it's very important to work with your doctors to determine what is causing the pain or symptoms and what treatment options are available. Untreated or undertreated pain, as I already said, causes great damage to our bodies from head to toe, and as well as our mental health. Symptoms that are not well managed can worsen and can become bigger problems if they're not looked at, if they're not managed and treated. Anytime we have a new symptom, it's important not to assume, first of all, that it's caused by our EDS or HSD. We're not protected from inheriting, acquiring, developing any other health condition comorbidly. So don't always assume that it's an EDS or HSD cause, first of all. But when you have a new pain or symptom, work with your doctor, figure out what is causing it and how to effectively manage it. If you have everything effectively managed and you know what's causing your symptoms, sure, stop seeking treatment for a while. But anytime you have unmanaged pain or symptoms, or you have a new symptom or pain that you haven't been experiencing, please see a doctor. One of the scariest things, I think, I have known 2 people now in our community who had an increase of pain. They assumed it was the cause of the EDS was the cause, that it's just, EDS causes pain and here's more pain and that's it. So they didn't go to their doctors to see what might be causing the pain. In both cases, by the time they went to the doctors to see what was causing their pain, each of them, several years apart, were diagnosed with stage 4 cancers. Stage 4 cancer is very hard to treat successfully, and they both lost their lives. These people weren't unknowledgeable about EDS. The first one was Nancy, who founded the Ehlers-Danlos National Foundation. The second person was my friend Sue. She was the one who did the job I'm doing before me. She finally was diagnosed with stage 4 cancer when she went to the doctor and called me and asked would I take over for her. She didn't have more than a couple months left to live. So please, please don't assume every pain and symptom that is new to you is caused by your EDS or HSD. Work with your doctors to determine what is the cause. And so, yeah, I'm going to turn it over to you, Rebecca. Sorry for that. I kind of got on my soapbox.
No problem. Thank you. Next question. Are there any trials using exoskeletons or robotics to help people with EDS be more active while protecting joints? So this was an interesting question. We were not aware of any clinical trials on exoskeletons or robotics to help people with EDS or HSD specifically. There is research being done for the use of these things for people with other health issues. There have been amazing advancements in the use of robotics for those with amputated limbs, paraplegics, quadriplegics. There are also advancements in 3D printing and other materials to make braces and exoskeletons for people with different types of disabilities. And many are still in the research stages, not yet available to the public, but we're getting closer and closer to the time that they will be. And we'll kind of have to wait until then to see what they come out with, to see if they will be helpful for the Ehlers-Danlos syndrome community and hypermobility spectrum disorder community or not. We'll just have to see what comes our way. We will have to kind of evaluate them and see, is this going to be something like braces that carries that risk of muscle atrophy with overuse? There are a lot of things in the research stages now that it's unclear whether or not will be helpful for us, and we just kind of have to wait and see what comes of all these different trials, and hopefully there will be things that will help the whole community. Shani talked before about setting filters on Google Scholar and keeping on top of EDS research. It is also a good idea, if it's something that you're interested in, to keep looking at research in kind of a more broad medical sense, to see what's new in the field of robotics and the scientific discoveries out there. There's so much interesting work going on, and hopefully there will be a lot of big advancements that will help those in our community.
Mm-hmm. Very true. And something else I've been watching is there's a lot of research being done on genetic therapies. And so these are not EDS specific research studies, but that's okay. They are making progress in the research to be able to make an impact on those with genetic conditions. As this research continues, then it can be determined whether or not it's applicable to those of us living with a type of EDS or HSD. But keeping an eye on that broader world of medical research is a great way to feel hopeful about the future. We have this question, are there ways to get help with the cost of braces and splints if insurance won't cover them? That's a great question. Some makers of braces or silver ring splints have payment plans or have sales and ways to get them cheaper. For silver ring splints, you're more likely to get that kind of option if you are working with a company like Silver Ring Splint Company rather than an individual maker, for instance, on Etsy. You can also look at things like Craigslist and on Facebook Marketplace to see if people are getting rid of braces or splints that they don't have yet, that they don't need anymore. For some, using kinesio tape or similar products can be used instead of a brace or ring splints. Compression clothing can help support. And so thinking of other options besides braces or splints can help you find cheaper options as well. But I'm going to say it again. Sorry, guys. Consistently doing EDS and HSD appropriate physical therapy exercises and moving your body every day can increase your muscle tone, which can lessen the need for braces and such. So over to you.
Okay, and this is our last question that was submitted to us that we're going to have time for today, since unfortunately we are way over time. And I think Joe is putting it into the chat, but if you have any additional questions or any of the questions that we discussed today, sparked questions, please feel free to reach out to us. Our helpline is here. You can call us, you can email us. If you go to our Ehlers-Danlos Society website, all of our contact information is there. We have toll-free numbers you can call. You can email us at any time, and we are happy to answer any questions that you have to the best we can. So the last question, are there any ways to get medication samples when the company will only provide them to a doctor, but the facility the doctor practices at forbids samples? So unfortunately, no. The only legal and safe way to get medications is from your doctor, either with a prescription, or if your physician gives you a sample to try and it's recorded in your chart. This protects you as a patient. We don't want anyone getting medications from friends on the black market, anything illegal like that. It is not to your benefit. You want to do everything the right way and stay safe. And thank you so much for joining. Thank you for sending in your questions. We look forward to talking to you, emailing with you, answering any other questions that you have, and hope everyone stays safe and healthy.
Exactly. And also please join us for our virtual Let's Chat groups, as well as our virtual support groups. And it's a great way to be able to talk with others about some of these questions too, to ask how they're managing their symptoms. And you can find that information on our website under virtual support groups. Thank you, everyone.
Alrighty, thank you so much, Shani and Rebecca, for your diligent work, not only on this webinar, but what you guys do every day when you're responding to and helping members of our community and their medical professionals find the answers that they've been searching for. We did have a couple questions come in during the webinar, but like I mentioned in the chat, due to time, we're not going to be able to get to them. Please reach out to the helpline with those questions. Shani and Rebecca will do their best to get those answers and provide guidance as soon as possible. But unfortunately, that is all the time we have for today. You guys gave us a fantastic inside look at how helpful the helpline can actually be. If you guys would like any more information about anything that was presented today, any questions that were answered, check out our website for more resources and information. Feel free, once again, to give our helpline a call or an email, and definitely consider signing up for our newsletter if you haven't already. It's a fantastic source for the most up-to-date information and upcoming events. Our next webinar will be on April 1st at 1 p.m. Eastern Time. We have Dr. Demirtas presenting a webinar on classical-like EDS. You can look for that sign up on our webinar page on our website. Technology permitting, this webinar should be available on our YouTube channel within the next week or so. If you found this webinar helpful in any way, please consider hitting that like button once it's available on YouTube, and subscribe to our channel so that you can be alerted to when we're uploading our most recent videos. Once again, thank you so much, Shani and Rebecca. I hope that you guys and everybody that joined us today has a safe and healthy rest of your day.